Oh, hello. I didn't see you there. My name is Mike. I'll be your guide today to introduce you to some various scenarios you'll face in the clinic. Today's topic is health literacy and your patients. Let's take a look at the clip, shall we?
And we're done with your examination. Now I'd like to go over your treatment plan.
Sure, that sounds great.
So we're deciding to do it. Well, what I noticed is there's a CVC crown on number 19 with a leaky buccal margin. So you have caries that are getting underneath there and your tooth is being all decayed. And what I want to do is I essentially want to do a root canal and then build up, do a post and core and then put another crown on it. Does that sound good to you?
Yeah, hey, sounds great. You know what you're doing, so I trust you.
Perfect.
Great.
I'll get you scheduled.
I'm going to be honest. I have no idea what that man said. He was just rambling about all these big dental terms, and I never learned any of that in school, and I never went to the dentist as a kid, so man, I had no idea what he was talking about the whole time, but I just kept nodding, and I feel good. I feel like I've known him for a long time, and so I feel like I can trust him, but honestly, I don't know what treatment I'm going to get. I don't even know which one of these teeth are hurting, so who knows?
Mr. Mann, well, thank you for coming in today. I'll walk you out to the front and
Sounds
get you
great.
scheduled.
I don't think Mr. Mann really understood anything that Dr. Guy said. I think a lot of the terminology was pretty advanced. I don't even know if any of that treatment option got through to Mr. Mann, so I think I'm going to have to talk to Dr. Guy and see if he has a better way of explaining things. And am I in the shot? It looks like the camera's a little low. Could you maybe raise that up a little bit? Hey, Dr. Guy, how you doing?
Hey,
Good. How's it going?
good to see you.
Good to see you as well. Hey, I overheard you talking to your patient, Mr. Mann, the other day, and I noticed a lot of the terminology you were using was really advanced. And I actually heard recently on the National Assessment of Health Literacy, only 12% of our adult patients are actually health literate. So, I think it might be a good idea for you to go back, maybe explain some of the things in a way that he can understand, so that maybe, you're both are on the same terms when you go through that treatment plan. I think it'd be a good idea.
Yeah, that's a good idea. I do remember I was kind of tired that day and I wasn't
Yeah.
really thinking about how I was phrasing the treatment plan to him, and obviously I understand it, but he may not, so I didn't really
Right.
consider that. But
Yeah.
thank you for bringing that to my attention.
Yeah,
And next
absolutely.
time Mr. Mann is in, I'll be sure to bring it up and phrase it so that we were walking away both understanding what the treatment is.
Yeah, that sounds great.
Man, I first want to apologize for being confusing during our first appointment, and I'm glad you came back because I wanted to make sure we're both understanding what the procedure is going to be. I want to make it nice and simple and easy so that way we both walk away understanding it. So what is wrong is the crown on your molar on your lower left side is open and not fitting properly.
Okay.
So there's decay that has gone underneath it and has taken away the tooth structure underneath it.
Okay.
So what I want to do is take that crown off and get rid of the caries and cavities on your teeth.
Okay.
And then what I want to do is I want to build up the tooth to what the decay had taken away,
Okay.
and then put a new crown on, so that way it'll be nice and healthy.
That sounds great. Well, I really appreciate you going back and clearing that up for me. It really means a lot, and I think I have a much better understanding of what treatment I'm going to be receiving now. At the same time, one of my friends told me that he got an implant recently. Is that something you know about, or am I able to get that? Is that something I need?
Certainly, yeah, we can have another consult another time and talk about implant, and I think you'd be a great candidate for it. And I'm very thankful that you spoke up about that.
Great, thanks.
See, now that's how you teach somebody about dentistry. I fully understood everything that Dr. Guy was telling me, and I feel so much better about the treatment I'm going to receive.
Hey, you're back. I hope you enjoyed today's tour of the clinic and I have a greater understanding of health literacy and how critical it is to obtaining informed consent from your patients. I hope you join us again sometime.
The specific unethical practice in the video revolved around lack of informed consent due to the doctor's failure to assure patient understanding of the treatment. Patient autonomy, one of the 5 principles of dental ethics, cannot be achieved without informed consent. Therefore, understanding your patient's health literacy is critical.